How to differentiate between the spleen and kidney. The spleen is situated behind 9th, 10th, and 11th ribs, with its long axis, along the line of 10th rib. Anteriorly, it extends to the mid-axillary line. Posteriorly, its superior angle is 1.5 inch, 4 centimeters, lateral to the 10th thoracic spine. The surface marking of kidneys is indicated by the morus quadrilateral on either side. Draw 2 parallel horizontal lines on the back, at the levels of 11th dorsal and 3rd lumbar spines. They are intercepted by 2 vertical lines, drawn 3.75 cm and 8.75 cm, respectively, from midline. During palpation of the spleen or kidney, check for size, edge, surface characteristics, and consistency. Also, note the presence or absence of tenderness and movement with respiration. Methods of palpation of the spleen. The spleen can be palpated using 4 methods. To become palpable, it should have enlarged 2 to 3 times. In the classical method, put the patient in supine position and palpate from right iliac fossa to left hypochondriac region. Feel the edge on the spleen on deep inspiration. In the bimanual method, put the patient in the right lateral position. One hand of the examiner is put over the lower chest, and the spleen is palpated with the other hand. This method is used to palpate a soft spleen, which may be missed by the classical method. The hooking method is also known as Middleton's maneuver. Put the patient in the right lateral position. Stand on his left side and feel the spleen by hooking your left hand fingers under the costal margin. Exert your right hand pressure over the posterolateral aspect of the patient's lower thorax. Ask the patient to take a deep breath and feel the spleen at the end of inspiration. The dipping method is used in severe ascites, which may mask an enlarged spleen. Palpate as in classical method and dip your fingers into the abdomen with each palpation. This displaces the fluid temporarily to the side and facilitates palpation. Palpation of kidneys. The bimanual technique is used to palpate the kidneys. Palpation of the left kidney. Place your right hand anterior in the left lumbar region of the patient. Place your left hand posteriorly in the left loin. Ask the patient to take a deep breath in, press the left hand forward, and lift the right hand upward and inward. The left kidney is not usually palpable unless either low in position or enlarged. Its lower pole, when palpable, is felt as a rounded firm swelling between both right and left hands. It can be pushed from one hand to the other. This is called balloting. Palpation of the right kidney. Feel for the right kidney in much the same way as for the left. The lower pole of the right kidney is felt as a smooth, rounded swelling, which descends on inspiration and is bimanually palpable and may be balloted. Percussing the area of the back, overlying kidney elicits pain. This is known as Murphy's punch sign. It is positive in renal infection. Differences between left kidney and spleen. Left kidney is located posteriorly, in the L1 region, whereas the spleen is located anteriorly, behind the 9th, 10th, and 11th ribs. The edge of a kidney is rounded, and that of the spleen is sharp. Spleen has a notch in its anterior surface, while a kidney does not. You can insinuate your fingers between the costal margins of the left kidney, which can't be done in the case of spleen. The kidney enlarges towards the lumbar region, and the spleen enlarges towards the right iliac fossa. Kidneys are ballotable, while the spleen is not. Spleen moves freely on inspiration, whereas the left kidney's movement is restricted. The spleen should be dull to percussion, whereas the kidney can be resonant due to overlying gas. There is a splenic rub on auscultation, whereas the kidney does not rub. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest, and fastest way to take advanced clinical history.